and welcome to the CAO Continuing Quality Education series of webinars. This is the 18th CQE program in the series organized by the Quality Professional Wing of CAO. I'm Dr. Suvin Shetty, working as consultant pathologist and head Department of Laboratory Medicine at Dr. L.H. Hiranandani Hospital, Mumbai. I'm also part of the Governing Council of CAO as the Vice Chair of its Quality Professional Wing. CAO is a non-profit organization dedicated to the promoting of patient safety, quality, and accreditation in the healthcare delivery ecosystem. Through structured training programs aimed at imparting relevant healthcare quality skills to healthcare workers, CAO has trained over 13,000 clinical and non-clinical healthcare professionals till date. CAO is an institutional member of International Society for Quality in Healthcare, ISQA, and Asian Society for Quality in Healthcare, ASQA, and an elected member on the executive board of ASQA. Dr. Vijay Agarwal, as the slide shows, Dr. Vijay Agarwal, sir, is the president of CAO. Mr. Samir Mehta is the vice president of the organization. Dr. Lalu Joseph, ma'am, is the secretary general, and Mr. Sunil Kumar Sagar is the financial secretary. This webinar is being organized by the Quality Professionals Wing of CAO. It is one of the three main verticals of CAO and is dedicated to nurturing the professional needs of healthcare workers, especially those responsible for quality in their institutes. Dr. Anuradha Pichmani is the chairperson of the Quality Professional Wing of CAO, and Dr. Anna George, who will be joining us later, is the secretary of the wing. The CAO Continuing Quality Education webinar is a 3-hour virtual conclave conducted on the last Saturday of every month. So we have been trying to cover each vertical of the healthcare ecosystem. This time we'll be covering about biomedical equipments. The sessions are aimed at educating healthcare workers throughout India and elsewhere on the best practices to adopt and implement with the goal of improving patient safety and quality of care delivery. We would like to welcome our partners for this month's CQE series who have contributed to the session, namely Fortis Hospital Mohali and ASQA, along with the knowledge partners Dozy and Minre. The theme for today's session is quality and patient safety aspects in biomedical equipments. On behalf of the Governing Council of CAO, I welcome everyone to the program and look forward to an engaging session from all the speakers this afternoon. It's my privilege to introduce the organizing chairperson for today's session, Dr. Shweta Prabhakar. She is the head Quality and Patient Safety and Academics at the Fortis Hospital Mohali. She is a senior NEBH assessor and she is a part of CAO Governing Council as the North Zone Chairperson. I request her to take the proceeding forward and introduce the organizing team and the program as such. Over to you, Dr. Shweta. Thanks a lot.
Thank you, Dr. Suvin. And so for this opportunity, really looking forward because a continuing journey in quality is a passion for everyone, and it's very dear to my heart. So I would like to thank you, CAO, as well as CAO leadership and the CAO Quality Professional Wing leadership under the able leadership of Dr. Anuradha, Dr. Suvin, and Dr. Anna. So they have been a really, driving force behind all these CQE series, I must tell you, and it's been really enriching to working with them and organizing this 18th CQE series. It's a proud privilege for Fortis Hospital Mohali. Fortis Hospital Mohali has been recently became the quality Center for Quality Promotion, and it's been a privilege for the hospital to present the CQE series, the first CQE series of the year. And the topic which has been untouched for various, for these years in CAO is the biomedical equipment. So this is one thing which we thought about to touch upon the quality and patient safety aspects in this particular department and particular area or specialty. So I would now, like to introduce my team. It's a small team, but it is a teamwork where we say that there is a lot of people, the back force behind it. So the team also comprises of the eminent speakers on board who have taken, have accepted the invite to be on the board as speakers and the panelists. My in the organizing team is my organizing secretary is Mr. Arun. And Mr. Arun is a biomedical engineer at Fortis Hospital, Mohali. He's been, over the years in this field for 13 years, and he's worked in various organizations. And he's really passionate about working towards improving quality and patient safety. And working with him over the years at Fortis Hospital Mohali is really enriching with him. So we realized that, let us spread and share the knowledge with respect to quality and patient safety in biomedical department. So with this, I would also like to introduce the MC for the day. The conclave, this conclave would be taken on, this whole conclave proceedings would be taken on by the MC, Dr. Sudeshna Ganguly, and she has been, again, a leader in her field. She's a medical director currently working with the Teledoc International, Health International, and she has been again associated with CAHO for many years, and also her background is that she has done emergency medicines, masters in emergency medicine from George Washington University of School of Medicine and Health, as well as she is the alumni of IIM Calcutta. And with her vast experience in both, in Indian culture as well as in the international settings, she has been really asset to the country as well as to CAHO. I would hand over to Dr. Sudeshna Ganguly to introduce our eminent speakers and take on the conclave further. We have a bouquet of topics related to quality and patient safety. I'm sure the participants would enjoy the session, the 3-hour session, and would interact with the speakers in the panel discussion, and wishing you an enriching learning 3 hours journey ahead. Thank you very much. Over to you, Dr. Sudeshna.
A very good afternoon to everyone here. Thank you so much, Dr. Prabhakar. That was a very kind introduction indeed. It's a pleasure to be here on this platform, hosting the CQE 18 series by the Quality Professional Wings of CAHO. And today we are concentrating on a very, very important aspect related to hospital and healthcare infrastructure, which at times we are not so familiar with, in fact. So I believe that through the enlightening sessions that we have with our very learned speakers and panelists today, we should be able to improve our in-depth understanding on this rather difficult topic.